Hi, everyone. My name is Kelly Hyman, and I'm a rising senior in business administration major at PC, and I'm also a member of the women's lacrosse team. For today's SAM Club interview, it's my pleasure to host Stewart Hackney, who is going to discuss the medical sales industry with us. Stewart is a PC alum who graduated in '96, and he then went on to get his master's at Clemson. He currently works for SeattleGenetics. Welcome, Stewart.
Hey, Kelly, how are you? It's a pleasure to see you here in this virtual environment, and it is an honor and a privilege to engage with a fellow Blue Hose, and hello to all the student body and alumni and faculty that might be viewing this. Go Hose Nation.
Go Hose. We're happy to have you with us.
Hey.
To begin, we'd like you to please tell us about your experience as a Blue Hose and any further education you've had beyond PC.
All right, so that's a great first question. So my experience as a Blue Hose was outstanding. I graduated in 1996. Somehow I got in and out in 4 years. Originally, I was from Cedartown, Georgia, so I wasn't too familiar with the state of South Carolina. But when I crossed over the state line on that first trip, I decided that I never wanted to go back. So I had a great 4 years at PC. I felt like it was a full, robust college experience. Like you, I was an athlete. I had a chance to play football and run track, while at PC. I also had a chance to participate in the Greek system, as a member of Pi Kappa Alpha. So I loved it. PC is such a wonderful, tight-knit community. The education that I received, I think, really prepared me to both navigate and think strategically about, what I wanted to be when I grew up, and then ultimately have the tools and skills necessary to approach, my career at the beginning, and also have the mindset to evolve, once I got into my career. The second part of your question was around further education. One of the things that you'll hear me talk about when it comes to education is just a firm belief in lifelong learning. My mother ran the adult education component for the state of Georgia for years. My wife's a school teacher. Her mom was a school teacher. So by extension, my mom's a school teacher. So I come from an environment of educators. And so you just can't help but believe in, again, lifelong learning. And so based on that, I did go on to Clemson University to get a master's in human resource development, because I thought that was something that was super interesting to me because of the mindset around corporate culture and how do I get more from a field force, or a workforce based on their training, assessment, the skill sets that I can deploy with them, the engagement that I can create with them. Essentially taking, an existing workforce and equip them with an attitude and a skill set that at the end of the day increase, their productivity, their job engagement, and their experience, which at the end of the day only benefits the organization. So that's what I've done. So I graduated from PC in 1996, and I most recently graduated from Clemson, with a master's in human resource development.
Well, that's great to hear, and great to hear you had such a great experience at PC too. So our next question for you is, what is your professional experience before you arrived at SeattleGenetics?
My professional experience before I arrived at SeattleGenetics. So this is a great question. So, I graduated in 1996, and I, went almost immediately into medical sales, which is, the purpose of our conversation today. I started as, a frontline salesperson in what you would consider kind of a mass market. It was selling, like cardiovascular medications in, a small rural geography in southern Georgia. And, at the time, the pharmaceutical industry was on the cusp of what you would consider just a rapid expansion. So this is in 1997 is when I started. And, I've always been focused in on development. So, each position in my mind was intended, you learn and you perform and you excel, and then you use it as a stepping stone, into something else, if that's what you want, and I've always been the kind of person that tends to start to get a little bored, after, maybe 2 or 3 years in any given role. And I like looking forward to what the next challenge is. So, over the course of, the next 21 years, I've had a host of responsibilities in different roles in different organizations. So from that first position selling cardiovascular medication in South Georgia, moving into different what you would consider, customer facing roles, so different types of customers. So, one role focusing in on, your primary care doctor, and then the next role you're focusing in on hospitals or large systems of care. And then the next role you're focusing in on, a different type of specialty. Like in my case, I moved into the hematology oncology space in 1999, and it's so fascinating and impactful and meaningful. I've stayed in that particular industry ever since, and just stayed, in that hemonc space, but just in different roles and organizations. So the list of companies that I've worked for, I started with the Upjohn Company in 1997. That turned into, through merger and acquisition, another company called Pharmacia, which turned into another company, was purchased by Pfizer. And then I made a strategic decision to leave Pfizer and go to Novartis. That was based on a couple of reasons. Number one, I thought that there was a greater development opportunity for me at Novartis. And then the other part that you'll hear me talk about later on, based on what I know that you wanted to ask, is, looking at your industry and what we knew at the time. My wife and I made the decision in 2003, that Novartis as an organization had a great pipeline. So the science that they were working on really foretold a lot of success and, a lot of commercial, products that would be brought to market. So we made the strategic decision to move over at that time in 2003, and we stayed there until 2010, just in roles of increasing responsibility. And then we moved over to a small biotech, again, focused on cancer, therapeutics. That one was fun because, again, if you're, paying attention to your industry and you know what's going on, that company was the first to bring an immunotherapy to the US market. It was actually the first globally. So immunotherapy is kind of the hot item, in the world of cancer treatment. So instead of using what you would consider like a toxic, chemotherapy to treat a patient, what this company was able to prove was that you could engage a patient's own immune system and turn the body into, a weapon of mass destruction against cancer cells. So something that is, highly beneficial and therapeutic to the patient, but also not nearly as toxic to the patient. So the treatment quality of life potentially could be a whole lot better. And so, again, that immunotherapy theme has been something that's continued to play out. I went and spent 5.5 years at Merck, and again, just different roles, but again, focusing on cancer therapeutics. And now currently I'm at a wonderful company. I'm so blessed to be at SeattleGenetics. So that's the company that I'm currently with. I've been here for 1.5 years. The role that I'm in now, again, I always tend to try to change roles every couple of years just because it's fun and I like to take on new challenges and learn new skill sets. So I'm in a role now that focuses in on finance and contract management, big, large groups, that are nationwide across the country, to ensure that patients have access to, medications, to ensure that from a competitive standpoint, that we aren't, putting customers in adverse financial, situations, so you're involved in things like pricing decisions and reimbursement, through healthcare payers, things of that nature. So that's the experience that has brought me to you today. And I'll speak a little bit more, about the thought process associated with that as we, move into our conversation.
Sure. Well, that sounds like such an interesting career path you've had, and it's certainly a very important industry, and you've seen a lot of change and excitement over the years. So we'd like for you to elaborate on your current position and company, SeattleGenetics.
Sure. I touched on Seagen briefly before, and I'll talk a little bit more about what they do specifically that was so enticing to me. And then, what I think, can be applicable to, PC business students that, want to get into healthcare sales. So SeattleGenetics is a small biotech that's based in Seattle, Washington. It's a great story. It was founded in 1998 by a guy named Clay Siegel, who is still the CEO today and chairman of the board, which is not something that you see typically, for somebody to still be, in a position like that, the founder still be, associated with the day-to-day operations. So they came with a science, called ADC, or antibody drug conjugate, which is cool in the sense of it creates, the ability for a targeted agent, specifically targeted for, a cancer protein or biomarker, and they link it, with, essentially, a delivery mechanism. So you can have a cytotoxic agent that kills cancer cells linked to, a rocket that takes it right to, for lack of a better descriptor. So, it's ADC, antibody drug conjugate, and SeattleGenetics is the leader, in antibody drug conjugate technology. So that's why I wanted to be a part of them. So they had one product when I joined in the spring of 2019. Today we have three. So we brought two new therapeutics to the market just in the last 5 months. So we're very much in a growth phase of the organization, and I love, hearing Mr. Segal talk about, it's awesome that we've gone from one product to now three, and his job is to, go from the three products that we have today to numbers 4, 5, and 6. So what I do, in my role, again, I'm focused in on finance and contract management, large customer groups across the country. So, our job is to take the commercialized products, and make sure that they're used appropriately, and that we maximize the potential of the science behind them. And then his job is to take what we produce in terms of sales and revenue, and then he invests that, into, research, for the next product, to come down the line to potentially help patients.
Wow, that sounds like a really great company and very interesting. And lastly, we would love to ask you, what advice do you have for graduating students who would like to go into this field?
What advice do I have, or tactics? So I think the question that you had sent over, what tactics do I use? Is that kind of the same thing?
Yes, yes.
Perfect. Well, so I think that that's a great question. And I think that anybody that you ask could go all day, Kelly, because, there's no right way, right? At the end of the day, to me, what I value the most is listening, right? Getting on the same page with really whoever you're talking to. It doesn't matter if it's in a personal conversation or if it's in a business setting, the ability to understand and, listen with intent to, the customer or the professor or your friend or your parent, whoever it might be. Am I really listening to you, or am I waiting to speak? And I am the world's worst at it, going ahead and thinking about, what my response is going to be, prior to, somebody finishing their sentence. So I think that that's, the big thing in terms of, an idea and that you can use, in this type of setting, is listening with intent. And at the end of the day, trying to figure out what is valuable to the person that I'm meeting with, or the person that I'm having a conversation with, because if I understand what is valuable to you, then, the conversation that we have, or the actions that I take, or the benefits that I might be describing, are going to be in line with what you need, as opposed to, me rambling on whatever my agenda might be, and it's not in line with what you deem to be value added. So if I do that, then you're really not going to listen, and you're not going to take away, what I'm hoping that you would. What I really want for, people that I engage with, again, both personally and professionally, what I want them to take away is that, I genuinely care. And, if I'm talking about something, something that's sales oriented, if, what I'm selling may not be appropriate for you, and I'll be the first person to say, this really isn't appropriate, for what, your needs might be. And I also want people to understand how sincere and genuine, that I am. Like, I really care about you, and I care about what you're working on, and I care about what's going on in your life. And I just want to make sure, that I'm doing everything that I can that is supportive and value added, to what it is that you're working on.
Right. Well, that's very important, and sounds like a great philosophy to have, is to be passionate about what you're selling as well. So lastly, we would like to ask what advice you have for graduating students that would like to go into this field, or just in general, graduating students at PC.
Okay, I do love this question, and you can tell I built the slide that I'm going to leave up now, because there's a lot. And so I think that there's a couple of things for success that, could be embedded into your thought process. So for me, there are, two sides, that you have to, quickly establish, when you're coming out of school. One is, a real solid set of convictions, Kelly. Convictions being, around your faith, around your work ethic. Are you organized or are you not? I think that we've all, in a COVID quarantine environment, quickly learned that you have to be organized, about your day, because if you're working from home or, you're working remotely, like most medical sales are, you have to have a system in place, to keep yourself, your thoughts, your business, organized and compartmentalized, so that you are the most efficient that you possibly can be. Another thing that to me is just a strategic imperative is just to have the right attitude, being positive, looking at the bright side, knowing that you're not in control of, the macro things that, are in play in life, right now. Having a sense of community. When I say a sense of community, Kelly, I tend to think of, how do I fit into the bigger picture? So I think personally, it's good and important, to be mindful of how am I giving back? How am I serving others? One of the things that still to this day resonates with me almost on a daily basis is the Dum Vivamus Servimus motto from Presbyterian College. While we live, we serve. And so, your community, your church, your neighbors, sports or, clubs around that you can volunteer for, food pantries that you can volunteer at. I mean, there's a big world and there's a lot of need. And so I think that it's imperative that we all be mindful, of that. And then lastly, I have two sons now. One's a senior in high school, one's a freshman in high school. What my wife and I, I hate to say it, but we almost preach to them, to be their best self, right? I mean, you've been given a specific set of gifts and talents and skills. Don't let them go to waste. Challenge yourself, push yourself, be your absolute best person that God gave you the ability to be. On the professional side, Kelly, my advice would be, to think strategically and long term. So strategically, can be, both in the near term, and then you also have to think, where do I want to be, 1 year, 3 year, 5 years, 10 years from now. I ask myself all the time, like, what's my end game? I do it for small projects. I do it for long-term projects. At the end of the day, what do I want this to look like? And then establish a plan for incrementally, how am I going to get there? So, what are the specific tactics that I'm going to use? What type of time-bound measurements, can I add to? So that, if I've established what my goal is, when am I going to check to see if I've hit it? What is good going to be considered to be? And then, write it down. I'm a big believer. If I don't write something down, odds are I am going to forget it. So I have lists going all over the place, and I love that. So, the satisfaction of scratching through, the list as I, get things done. One piece of advice, Kelly, that I would have, for myself, for you guys, for my family, is just to be flexible. Change is absolutely constant, especially in this particular field. I mentioned, when I started in the late 90s, we had, maybe 50,000, sales marketing reps in the US across all the industries. That number ballooned to, almost 100,000 as we got into the early 2000s or the aughts. And then it's contracted back down, to 50 or 60,000. Again, this is total sales and marketing personnel, across the pharma or medical device industry today. And that change is due to a lot of reasons. It could be macroeconomic. We've gone through a couple of recessions, in that 20-year period of time. You're constantly exposed to legislative changes, in terms of the way organizations, can market. You're exposed to the science associated, like with your company. So again, paying attention to the innovation and R&D efforts that your organization is putting forth. And that kind of leads to the next bullet point about constantly educating yourself. So you need to be in this field or in any field that you go into, just be an expert. Like, constantly read, constantly develop yourself, know what's going on, know about things that potentially impact you, your role, your company, your competitors. Just have a very keen awareness of the broader landscape. And that, ultimately prepares you, to make the right decision at the right time. I love, so, every candidate that, we've had a chance to meet with, over the course of my career, to me, what stands out, I mean, people come from all different kinds of backgrounds. They come from, business backgrounds like you guys are getting at Presbyterian College. We've hired education majors, we've hired people from other industries. What I really love to see, and or what has really determined to be kind of the best predictor of success, has been those candidates, Kelly, that you can see the strategic thinking, in their mindset. You can see it in the way that they, approach college. You can see it in the way that they're approaching, the early part of their career in terms of, this is my goal, this is how I was going to achieve it, the steps that I took. And then, like I said, the strategic nature of the 1, 3, 5-year plan, this is what I wanted to do, and this is how I prepared myself, to get to that mark. Somebody that thinks in that way, is just, they're engineered or they're wired to have success because they're goal oriented. They've demonstrated a strong work ethic. At the end of the day, they're not going to be satisfied until, they have achieved, their goals. And that's the kind of person that you want to surround yourself with. And that's the kind of person that you want to hire or the kind of person that you want to work for. And that kind of leads me to the last part, the networking aspect, which is so important, as, kids come out of school today. It's important for, people like me that are deeper into our careers. It is important to network around, but one of the, to me, the most important aspect of, building out your network is to do it in a way of, how can I help people, as opposed to, building a network based on the notion of how can this person help me, because you're going to see it. There are people, that, can be self-serving in terms of the way that they, are trying to, leverage a relationship, or build out, their network, and it's kind of internally focused. And so, like, back to the point we were making earlier about, being a part of your community, being a positive contributor to your community, the same thing applies in the professional setting on the networking side. So if you're constantly looking for how can I help others and how can I serve others, don't be them a service, then, at the end of the day, it's going to benefit everybody. It's going to benefit you, and it's going to benefit the people that you ultimately get to help. And then, just like you said, Kelly, you just never know who you're going to come into contact with later on, especially like in the medical sales industry, having, I guess I'm now in my 23rd year, and the number of people, that I've met, during that span of time that have moved, into high ranking positions, and then they move over. And then, one day, somebody's reporting to you, and then, the next day you're reporting to them, just through, attrition or company changes or things like that. So that's why, like, you never know, like, who you're going to meet, like who from your past is going to be, part of your future. So if you have that mindset of helping others, being kind, have a good heart, always be mindful, of the work ethic and the conviction that you bring to each and every role and opportunity, then you're going to have a lot of success.
Well, thank you so much. That is really awesome advice. And we really thank you for your time today. This has just been such an informative interview. It's been really beneficial to myself and especially other PC students. And we wish you continued success in the future and look forward to keeping in touch with you.
I thank you. This has just been wonderful. And my name, again, as a reminder, Stewart Hackney. So, part of that networking thing, you can look me up on LinkedIn. I'd love to support, connect with, any of the PC students, that are seeing this, anything that I can do, to help, you get going in this career, this field, if that's what you want, or in others, So again, Presbyterian College is a fantastic school, and it's got a very diverse, set of alumni in a lot of fields. And, what I've found is that each and every one of them, had a wonderful experience at Presbyterian College and is also always willing, to help out, somebody like you guys, that are getting to begin their career, here in the next year. So thank you again for the opportunity.
All right. Thank you again. We look forward to keeping in touch.
Yes, ma'am. Talk to you soon.
Talk to you soon.
Bye. Go Hosts.
Bye. Go Hosts.